News Channel 5 Network, this is Morning Line with Nick Barris.
Good morning, everyone. Thanks for joining us on Morning Line on this Tuesday. It's good to have you here. I'm Nick Barris, and we're going to open up the phone lines in a moment as we talk this morning about hearing, okay? Your sense of hearing, one of the very important senses that we have, and whether you suffer from hearing loss, you're thinking about getting a hearing aid, you know, you have a loved one maybe, and how to address that issue with them, or maybe you just wonder, how is my hearing, you know, as it gradually leaves, maybe you don't know what you're missing right now, and you actually could use some help. We've got the number up on the screen, 737-7587. We're talking hearing health. And it's not going to be me. It's going to be the experts from Middle Tennessee Audiology. And let's introduce them. You know, I mean, Noreen, she's been on before. Yes, and she's obviously had a great time because she's back to hang with me. And why wouldn't you? Maureen Gibbons is with us this morning. Noreen Gibbons, she's a doctor of audiology. It's nice to see you again.
Nice to see you again.
Thank you for coming on.
And thanks for having us.
Us. It's not usually, it's just the two of us. And she's brought with her Meryl Geiger, and she is a resident.
Yes, she is.
I am. Yes.
Hello. Meaning, in training.
Correct.
Mm-hmm. She's in her 4th year of training, so in May she will complete it, and then she'll be a doctor of audiology.
Talk a little bit, you are a doctor of audiology. Just for folks, you know, all right, when you say doctor of audiology, what type of background do you have?
Well, the current guidelines are that 4 years of undergraduate work in something, there can be a variety of undergraduate degrees. Meryl has an undergraduate degree in speech pathology and audiology, which many of us do.
Is that what you have?
Yes. There's also many people that come from a psychology background, a pre-med background. A lot of different undergraduate degrees are now accepted into the doctoral programs around the country. So they leave that undergraduate degree and then go into 4 years of training. The first 3 years classroom work, clinical rotations, and then the 4th year is an extended clinical rotation in a place like Middle Tennessee Audiology or some other locations or clinics where they're asked to see patients on a full-time basis and work with a supervising audiologist.
Okay, and that's where she is now.
That's correct.
How'd you hook up with her?
Funny story. My grandma has hearing loss and got her hearing aids with Dr. Gibbons.
Wow.
And we just started talking about 4th year, and since I'm from this area, I went to school in Arkansas.
Okay.
So I was ready to come home, and it really worked out well for me to be here. So
that is awesome. I'm just curious, in the field of audiology, is it growing? I mean, I know the technology and we keep getting better and better at that, but are there a lot of audiologists?
There are not really enough. In fact, if everyone who actually needed to have hearing aids and could benefit from hearing aids and audiology work, whether it be cochlear implants, balance problems, tinnitus, if everyone showed up in clinics tomorrow around the country, we would really have a problem.
Really?
Yes.
So, I mean, so you would
shortage.
imagine there are folks out there watching this program, some of whom are involved and know that they have issues and have dealt with them, but are there a lot of people out there? What percentage maybe have an issue with hearing loss and don't know it?
Depends on the age group and the hereditary issues or noise exposure, but it is the 3rd most common condition for people 65 and older. So it really is a large percentage of the population. For those with noise exposure, it's much greater.
Okay, and 65 and older, I was going to say, as you say, there can be genetic issues, there can be issues when you're younger, but really hearing loss can start kicking in for more normal humans as they age past 65, much like maybe vision degrading?
Very much so. We do see a lot of people, even in their early 30s and 40s, they might come in complaining of hearing problems. There might not be what we call a peripheral hearing loss, or the inner ear might be functioning well, but there can be some processing issues that develop in noisy environments. And then in their 50s, we see a lot of people that are coming in at that age because they're having difficulty at work and in different environments, and many of those do have a hearing loss that needs some evaluation and treatment for certain.
Why'd you go into it? I mean, she said it's good that we have more folks going into this.
I went into it just to help people because I wanted a career where I could leave at the end of the day and feel like I've helped somebody improve their quality of life.
But I mean, you can do that in a lot of the medical field. But, but the hearing, is it because of what you saw your grandmother going through, or?
Somewhat, yes. So with that speech background, you take a couple courses in audiology, and I really liked the technology aspect. and getting to work with a product or a hearing aid that helps somebody. And it did kind of, my grandma's background, I guess, helped a lot with me deciding on that. But it is a really great field just to be able to bring somebody that option to have access to sound and to speech and to communicate. I mean, we all want to communicate, and if we can't hear, then we're going to have a breakdown in communication, which creates a whole lot of other problems. So
it is just crucial for so many other things, hearing, when you think about it.
It is.
Obviously communications, and aren't they also, can you explain to me what the link is between hearing loss, or maybe kind of being tuned out, and the connection to memory loss or Alzheimer's?
Yeah, there's a lot of theories out there. The one prominent theory that is out there is that hearing loss creates kind of a multitasking situation that's a cognitive overload. It's people are straining to hear and understand what's going on, and as a result they're working their system too hard, and it can't, there's some breakdowns that start to occur. That can't necessarily be proven yet, but we know that when people treat a hearing loss, we can slow the progression. That's the important research that we needed. It was, you know, disappointing to hear that it was creating the problem, but to know that we can improve or at least slow the progression of it is really important to find out as well.
Okay, well, we're going to talk about treatments and the like. We'll take phone calls, the numbers on the screen. If you can, then, can you lay out for our viewers what the primary causes are of hearing loss? And I know there's a variety of them, but what would you say are the most common reasons people suffer hearing loss?
Noise exposure.
Number one is just noise exposure. Going to a lot of concerts, wearing your headphones super loud.
Correct. Power tools, firearms, for the military, obviously all sorts of noise exposure. Industrial noise exposure. I worked many years in Southeast Michigan where the auto companies in some places were extremely loud, and there was a limit to what they could do to protect those workers. You can put headphones on and earplugs on, but when sound gets to a certain level, it's going to travel right through the bones of the skull, and it's going to impact the inner ear. Yes.
Even if you've protected your ear?
Yes.
Meaning is it vibration?
Yes. Yes. If it gets to a certain level, it doesn't matter what the earplugs are doing. That's where there's hope that some of the medicinal approaches or some sort of protective medicine that we can use to prevent that from happening. There's a lot of good work being done, but it's just not ready to be out there yet.
Really? That a medicine that would help, you know, stop those vibrations from?
To protect the inner ear from damage. So not stop the vibrations, but protect the inner ear hair cells. And there's a lot of work being done with the military to try to prevent that, and that's a somewhat captive audience that they can try some of these things on, and most of these military members are ready to try to protect their hearing. It's very important to them because they know.
Do you have some clients that are veterans? I can imagine if they were working artillery, or you know, if they were in a situation where they ran into an improvised explosive device and the shock wave with that affects their hearing.
We do. The VA system takes care of most of those folks.
Sure.
Meryl's husband is a veteran, as a matter of fact. I not talked to her about any noise exposure he may have had, but we do see a fair number of veterans who maybe can't access the VA as quickly as they would like, or they choose not to. We also see a lot of first responders. This is the group that really needs our attention too. The police officers, the firefighters, anyone exposed to a siren on a regular basis, they are very much at risk, and so they typically don't have the same benefits or the same access to hearing health care, and it's a group that we need to be paying attention to as well.
Think about it if they're near it every day. I'm just trying to think as we go to the break. You know, we just had the 4th of July.
Yeah, we did.
And I don't get around it anymore, but there was a time I did, and my ears always rang on July 5th. And eventually, thankfully, it faded, but there was ringing in my ears. And, you know, I still remember sometimes some fireworks going off clearly too close to me, and I should have been farther back, right?
Yep. Yep, it's.
But it does now sustained. Why is it got better? What caused the ringing for that 24 hours afterwards, and then how did it correct itself?
Well, there is something called a temporary threshold shift that occurs when you're around noise like that, and the inner ear hair cells do recover seem to recover pretty much 100%, although they probably don't. There's probably some that still get damaged, but because there's 30,000 of them, they can kind of pick up for each other when the others have fallen down, for lack of a better term there. We can't really study it that easily, though, because it would take temporal lobe, you know, we'd have to take out your inner ear, and I don't think you're willing to have us do that too often. So it's hard to study. The animal studies that have been done suggest that the exposure, once it occurs, those hair cells are damaged, and there's not a way of regenerating them.
I was going to say, so you're born with a certain number of those hairs in your ear, and they don't grow more?
No.
That's it. Those are, you said about 30,000. I know 30, that's just that base.
Yeah, and
in each ear.
Yeah, and that's one part of the system. Of course, then you have the rest of the system, the auditory nerve and the processing centers, and some of those might actually get some damage. In fact, for noise exposure, it's a little harder to be certain. We know the hair cells because we can count those and see those under a microscope, but the neural patterns that get changed as well are a problem. We also have this issue of head injuries with the military and some other people that are first responders. Head injuries are unfortunately very common and very much a risk factor. So that's where we keep trying with the treatments to prevent it to begin with when we know noise exposure is going to occur.
Let's take a break on that note. When we come back, among other things, we're going to talk about hearing aids out there, what they cost, how you know if you need one, cochlear implants as well. She was telling me before the show just how many advances there are and all that. And if you're out there, if you have a hearing aid, if you're thinking of getting one, if you have questions for our guests, we can take those as well. 737-7587 is the number, talking about hearing health. Back with more and our guests right after this.